Imagine a headache so sudden and intense it feels like an explosion in your head. This could be brain bleeding. Learn how to recognize the signs and act fast to save a life. What is brain bleeding? Brain bleeding, or intracranial hemorrhage, happens when a blood vessel in the skull bursts, leaking blood into or around the brain. The brain is protected by the skull, membranes, and cerebrospinal fluid, but when bleeding occurs, the accumulating blood increases pressure on brain tissues. This can damage brain cells, cause stroke-like symptoms, or even lead to coma or death if untreated. Types of brain bleeding. Brain hemorrhages are classified based on where the bleeding occurs. 1. Epidural hematoma, bleeding between the skull and dura mater, outer brain covering, often caused by head injuries like road accidents or falls, can cause rapid loss of consciousness due to arterial bleeding. 2. Subdural hematoma, bleeding between the dura and the brain surface, can be acute, sudden, or chronic slow, common in elderly people and those on blood thinners. 3. Subarachnoid hemorrhage, SAH, bleeding into the fluid-filled space around the brain. Major cause, aneurysm rupture, a weak, ballooned artery bursting. Symptoms, thunderclap headache, worst headache of life, stiff neck and nausea. 4. Intracerebral hemorrhage, ICH, bleeding inside brain tissue. Common in people with high blood pressure. Can cause paralysis, confusion, seizures, or coma. Causes of brain bleeding. 1. High blood pressure, hypertension. One cause of spontaneous brain bleeding. Weakens blood vessels, making them prone to rupture. 2. Head injury trauma. Falls, accidents, or sports injuries can tear blood vessels. Elderly and kids are most at risk. 3. Brain aneurysm, a bulging weak spot in an artery that can burst. Risk factors, smoking, high BP, and genetics. 4. Blood thinners, anticoagulants. Medications like warfarin, aspirin, or heparin can increase bleeding risk. 5. Blood clotting disorders. Conditions like hemophilia, liver disease, or leukemia can make bleeding harder to stop. 6. Drug use and alcohol. Cocaine, amphetamines, and chronic alcohol abuse weaken blood vessels. Symptoms of brain bleeding. Symptoms depend on the size and location of the bleeding. Common signs include sudden severe headache, especially in subarachnoid hemorrhage, weakness, numbness, or paralysis, often one side of the body, difficulty speaking or understanding words, aphasia, loss of balance, dizziness, or confusion, seizures or unconsciousness, emergency red flags, worst headache of life, sudden loss of vision or coordination, rapid unconsciousness. Seek urgent medical attention if these occur. How doctors diagnose brain bleeding. 1. CT scan, first choice test, fastest way to detect bleeding in the brain. 2. MRI scan, more detailed but takes longer. 3. Lumbar puncture, spinal tap, checks for blood in spinal fluid, useful for subarachnoid hemorrhage. 4. Angiography, brain vessel X-ray, identifies aneurysms, arteriovenous malformations, AVMs, or vessel damage. Life-saving treatments. Emergency treatment, blood pressure control to prevent further bleeding, reversing blood thinners if the patient is on them, oxygen and IV fluids to stabilize the patient. Surgical treatments, craniotomy, brain surgery, removing large blood clots, endovascular coiling, a minimally invasive procedure for aneurysms, decompressive surgery to relieve pressure on the brain, medications, anti-seizure drugs if seizures occur, osmotic agents like mannitol to reduce brain swelling. Early treatment can mean the difference between life and death. How to prevent brain bleeding. Control blood pressure. Keep it below 120/80 mmHg. Quit smoking and limit alcohol. Reduces aneurysm risk. Eat a healthy diet. More veggies, less salt and processed foods. Exercise regularly. Strengthens blood vessels. Protect your head. Use seatbelts, helmets, and fall-proof your home. Conclusion. Brain bleeding can be devastating, but knowing the warning signs can save lives. If you or someone you know ever experiences a sudden severe headache, confusion, or paralysis, seek medical help immediately. Early diagnosis and treatment are critical for survival. If you found this video helpful, give it a thumbs up. Subscribe for more patient-friendly medical insights. Share this with your loved ones. You might save a life.